A warm welcome to everyone. My name is Divya, and Radio Diva started as a concept during lockdown. We were not able to meet each other, and we started Radio Diva to, as a platform to meet, to vent out. But now, over the 2 years, we have completed, and we are able to, have this beautiful connect with people experts join in, they share their expertise, their knowledge with us and help us be better version of ourselves. And of course doctors join in, amazingly qualified people join, and that's how we have our session tonight. We have a very important session tonight, and all of you please be part of our family. Join in through Insta, Facebook. We are still learning the traits of social media, but I really feel this platform is coming up as anyone who has something to share are coming forward, and we are lining up sessions for that. So I'm really privileged to know this person, though we did a session during the third wave. Dr. Sharad Joshi was kind enough to do a session with us. He is heading the pulmonology department of Max Hospital, Vaishali. He is Associate Director there. And at the same time, one thing I can tell you, he is an awesome human being. Nitin, my husband was unwell, and I messaged him, and within few seconds he responded. So he is just a call away, and that speaks volumes about his commitment for his profession. So I'm really excited and honored and privileged to have you, Dr. Sharad, with us. Today is Tej, Dr. Sharad, and I realized it quite late. So most of the women folk must be, in the puja today. I did not really know this is a very important festival for people, but nevertheless people will be watching this video on the recording on the YouTube. So let's go ahead and answer as many questions as possible, Dr. Sharad, and welcome to Radio Diva again, Dr. Sharad.
Thank you so much, Divya, for calling me or having me here. And today we are discussing about viruses. So I propose that the title should be viral viruses, because nowadays it's a trend that anything like a reel or a video or anything, it goes viral. So why this viral or virus is so much in fashion nowadays? The problem is that viruses had been there since centuries. So that's one form of life, and at the same time it's a non-living thing as well. So that's quite elusive, it's quite enigmatic, that viruses are actually just a chemical composition of nucleotides, and outside the body, outside the host, they are just dead chemicals. Inside the host, they are multiplying like any living being, and unfortunately in the process of this multiplication inside the host, they actually lead to a lot of inflammation and changes in the chemicals, and that is how the diseases are developed by the viruses. So anyways, because there are multiple viruses going on, we are listening about swine flu coming up, we are listening about bird flu coming up, then we have patients of monkeypox, there is another concern of tomato fever, and people making fun of the name, that what is tomato fever, you never had it in the world, it's just reported from India. So, and as well on the background, the COVID is still going on. So viruses are the present concern, and that is why we wanted to talk about it, to beat and defy a lot of confusion around it. So without wasting much time, and thank you so much for lovely introduction and kind words for me. So without wasting much time, I'll start with my presentation, which is about rampant viruses. So we start from the story of sapiens, Homo sapiens, or human being as we know them presently. And this is the start because I don't want to scare anybody, and I want to emphasize that Homo sapiens, or the present human beings, has been surviving on this earth for centuries now. But you need to understand, everybody has to understand one thing, that it's not humans who are living on this earth. We are sharing this earth with multiple bacteria, viruses, animal kingdom, lot of animals, birds, fishes, and everything. So there are viruses also on this earth surviving together in this environment all across our surroundings. We very well know for centuries and for many decades and years that there had been virus like HIV, human immunodeficiency virus, which leads to AIDS. We know hepatitis virus, which used to be a non-curable, non-treatable disease. We know viruses like influenza and flu viruses. We know that there are Ebola viruses, especially prevailing in Africa and claiming a lot of deaths and human life. There are rotaviruses, which are very common, and they induce diarrhea in children. Then herpes viruses. So these viruses, the rabies virus, for which we don't have any cure, any treatment till date. So these are long-standing viruses, and we have a lot of information about these viruses. But unfortunately, in the current era, we have come across there are few viruses which have mutated. So as at the start of my talk, I said that viruses are just dead nucleotides outside the host body. But when they come across with the right host, they get into the body, they get into the cell of these hosts, and they multiply, and in the process they actually make the host sick. SARS.
So there is a request to make your screen big.
All right. I'll make it a full screen. Sorry. Is it okay now?
Perfect, sir.
Yeah. So COVID-19, for centuries there had been virus like corona, but the viruses have a tendency of genetic mutation. Their genetic material, their genetic structure, their genes tend to alter itself by the interaction of the host gene, and that leads to that the process is called mutation, or in the layman language we can call it transformation. It is a biotransformation. So the parent virus is corona, but whatever mutations is adapted in the process of multiplication in any of the host, it formed a new virus which was called COVID-19. It was a novel coronavirus, and it was recognized in December 2019. And in last 2 years, we have seen the worst ever pandemic on this earth because of this particular virus, COVID-19. And we'll come to what many mutations it has gone in last 2 years in later slides. Then we have MERS, or Middle East respiratory virus. We have Ebola virus prevailing in African countries. We have swine flu viruses, especially coming from Asian countries, and bird flu, which led to a lot of culling of birds and stopping all the transport and import and export of birds. So the first virus which we'll be discussing in our talk is monkey virus. It's a rare disease. The monkeypox virus is of the family of variola virus. So mind it, although it is termed as pox, monkeypox, but the virus doesn't belong to the smallpox family. Smallpox used to be a viral disease which has led to a lot of scarring, lot of disfigurement, lot of human lives, and lot of the vision of the eye also. But fortunately, there was development of vaccine against the smallpox, and this disease has been eradicated since 1971 from the face of this earth. So by any means, the monkeypox doesn't resemble to smallpox. It's a totally different family of virus. Then why it is called as monkeypox? Because the lesion or the rashes it develops matches the pox family. So there are other pox viruses like chickenpox, like herpes. These are all viruses which gives rashes on the skin. They are different forms. They are different characters they have. And therefore, it can be separated, it can be discriminated and recognized. So monkeypox is a rare disease and it is rarely fatal. It is not related to chickenpox. It is not related to smallpox. And it was discovered in 1958. The first 2 outbreaks of pox-like disease occurred in colonies of monkeys, which were used for research purposes, for medical research purposes. And that is how the disease is known as monkeypox. But till date, the actual source of this virus is not known. The actual host of this virus is not known. So monkeypox is a misnomer. Just because it was found first time in the monkeys, it was detected first time in the monkeys in 1958. So it is named as monkeypox. It is not that monkeys are biting the people and that is how the monkeypox is developing. Sorry. Please do not fall into that trap. The first human case of monkeypox was recorded in 1970. So it is transmitted through close contact with the infected person. with the material contaminated with the virus. So we have seen that corona or the COVID-19 disease used to spread from close contacts with the aerosol, with cough, with secretions. But this particular monkeypox virus, it only spreads with the contaminated material and close contact of the infected person. So it's not an airborne disease. It doesn't spread with the air. Only close contact with the lesions, with the body fluid, with the respiratory droplet of an infected person or animal will cause a spread of monkeypox. It's a viral zoonotic
Mask
disease.
is not required, sir.
If you're dealing with a patient who is infected with monkeypox, definitely the mask is required. Definitely sterilization of hands and certain distance is required. Otherwise, not. All right, but we will be covering many viral diseases, and we'll come to the necessity of the mask. All right. So primarily, it's a tropical rainforest area of Central and West Africa. But now, in 2022, this disease has spread across the globe. There are more than 20 countries with more than 2,000 cases across the globe we have of monkeypox. But fortunately, this is a self-limiting disease. It doesn't cause a severe illness. The severe illness is only seen in 1 to 10% of patients. Depends on the variant or mutant of this particular virus. So it doesn't spread by monkeys. It actually spreads by rodents, the mouse, the bite or scratches of these animals. And then also human to human transmission is also possible. And kiss, cuddling, saliva, and sex. These are close contacts which actually lead to the spread. So initially, when in 1970 the disease was identified, it was actually identified in homosexuals. So the close contact actually caused the spread of this particular disease. But over a period, it has spread with bites and scratches of the animals also. So the typical symptoms of any of the pox or viral disease, the fever, headache, rash, and swelling of the lymph nodes, and muscular pains and body aches. These are the typical symptoms of monkeypox. These are typical rashes which appear after person is infected with the monkeypox virus. So there is a sequential change in the rash which develops after the monkeypox. There are formation of macules which are flat red spots. Then there is little bit of swelling which is papule. Then there are fluid filled swellings which is vesicle, which progresses to a larger size which is called as pustules. And this is the most infectious form because until the patient has these rashes, the virus can spread through these rashes because the liquid which is inside the rash, which is inside the pustule, is actually rich in viral content, and that spreads the disease. Later on, the skin lesions dry up, form the scabs. But there are other viral diseases like measles, herpes, varicella zoster, and syphilis, which are more common than monkeypox, and these kind of diseases also give rashes. But the pattern of rashes is different, and only a specialist, only a doctor you are advised to consult a specialist so that the rash can be differentiated and proper treatment can be given. So it's a DNA virus. It can be identified PCR test. It can be identified immunohistochemical test or electron microscopy, but definitely these tests are not readily available. And it is the detectable level of anti-orthopox virus, IgM antibody. The antibody test can also be done, but it will be positive up to 56 days after the rash onset. On July 23rd of this year, WHO director announced or declared this fast spreading outbreak of a public health emergency, and monkeypox was declared as emergency of international concern. This is the first time that monkeypox has been declared as emergency of international concern. How can we prevent it? It can be prevented by avoiding contact with infected animals and people, avoid contact with bedding and contaminated material of the infected person, cook all foods that contain animal meat. So this virus can actually spread with the contaminated animal meat. So people who are non-vegetarians or people who use animal meat for their food, their meal, they have to cook the food properly. Wash your hands frequently with soap and water. Safe sex practices are definitely required. Mask is required when you are in close contact, because you never know the patient actually who is carrying rash is actually monkeypox or something else. So mask is required. Then clean and disinfect the surfaces frequently. And person or the people like doctors who are taking care of these infected people, they have to wear personal protective equipment, PPE. How do you manage the cases of monkeypox? Just painkillers and simple medicines like crocin or paracetamol to be given for pain relief and care of fever. Then there are baths, because these skin rashes are painful rashes. So emollients or skin moisturizers and hot water bath that actually can help relieving that painful rash. Then isolate yourself if you are infected. Cover all the skin lesions. If you have got only one single skin lesion, cover it. If you have multiple skin lesions, isolate yourself. Take good care. Stay at home. Rest. Take proper hydration, because dehydration is one of the reason for complication in these patients. And avoid contact with pet. The antiviral agent tecovirimat, it is not available in India, but however, it is approved by European medical agencies for use in monkeypox cases. There are vaccines, Vaccinia gamma globulin, available for this particular virus. Definitely, smallpox vaccine gives some immunity, provides some immunity against monkeypox. But mind it, the people who are vaccinated against smallpox 3 years before, they have to retake or they have to take another dose of this vaccine. So I think all the people who are vaccinated for smallpox, they have got their vaccine years and years ago. So repetition of this vaccination is required. And it is 85% effective against this particular monkeypox virus. The alarming signs of monkeypox is whenever the monkeypox virus enters the lungs or the brain, it causes pneumonitis or pneumonia. It causes brain infection, encephalitis, or when there is infection inside the cornea of the eye. It can claim vision, it can cause disorientation or confusion, and it can cause pneumonia with low oxygen saturations, and patient can land up in ICU. So pneumonitis, encephalitis, and corneal infection, these are the serious complications of this particular virus, but they occur only in 1 to 5% of patients. So for centuries, we have been praying to monkey god, but this is the time to take care of monkeypox. Now on the horizon, we just came across new thing, which is tomato fever. So mind it, this particular fever is not because of eating tomatoes. It is labeled as tomato fever because this particular virus affects children below 5 years of age. And because of rashes and because of fever, these tender and cute kids are turned into red hot appearance, and that is why the fever is called as tomato fever. This could be after effect of chikungunya or dengue fever in these patients of children below 5 years of age. This can be a variant of hand, foot, mouth disease virus. But as of now, we do not know, the scientists and the medical people do not know what is the cause and actual cause of this tomato fever. The typical symptoms of tomato fever are fatigue, nausea, vomiting, diarrhea, fever, and dehydration, swelling of joints, body pain. It is just common to influenza-like symptoms. The name comes from red painful blister which grows up to the size of tomato. So it is not because of eating tomatoes, but it gives the appearance of tomato. That is why it is labeled as tomato fever. Most commonly seen in less than 5 years of age, and isolation is recommended, but we very well know that practically isolating a 5-year-old child or 4-year-old child is like impossible. So that the disease may spread to adults also. And the only medical literature available for tomato fever is from India. That was published in Lancet last month only. But it's a self-limiting disease. There is no specific antiviral drug available for this for this fever. And it's a limited disease. It spreads definitely, but self-limiting. So 5 to 10 days later, the disease will fade off. Fortunately, n number of viruses are there in bird, but our immune system, our defense cells, our white cells are tuned to take care of these viruses.
एक्स्ट्रा डॉक्टर
Gradually,
स्टेशन किसी आर्चे ने डॉक्टर शरद के साथ.
hello, hello.
Yeah, sir, go ahead. Somebody's mic was on. Go ahead.
Okay, so gradually, the immune system or the body defense system takes care of these viruses. It's just the initial 5-7 days of fever and body ache and this trouble, and there are a lot of rashes which are troubling, and that is how we take care of tomato fever. Then we have another disease which is very common in school going children, is hand, foot, mouth disease. So why this is labeled as hand, foot, mouth disease? Because children develop rash on their hands, the palms, the feet and the plantar surface, and around the mouth. There are red spots which appear, and that is why it is called hand, foot, mouth disease. They may form blisters also. This is a totally different viral family, Coxsackie virus. It's a self-limiting disease of school children. The complication is because of fever and because of maybe diarrhea in some patients, the dehydration can happen. The serious life-threatening complications like meningitis and encephalitis is very, very rare, less than 1% of patients. It's a self-limiting disease. You just keep the hydration, give them good multivitamins and antibiotics like paracetamol or crocin. The other concern is COVID, because even till now we are labeling it as COVID-4, the wave 4 which is going in our country. There are multiple countries in this globe which are going with the huge wave or delta variant. So in 2019 December, from Wuhan, the alpha variant of coronavirus was recognized, which was a totally new virus, new variant of coronavirus. And later on, the alpha variant was recognized in October 2020 in UK. Then there was beta variant in December 2020 from South Africa, gamma variant, because they never wanted to stigmatize the origin of that particular virus from any country. So it was not labeled as African virus or Brazilian virus or Brazilian variant or British variant of coronavirus. So they labeled it as alpha, beta, gamma, delta, kappa, lambda, mu, and Omicron, which is presently prevailing across the globe. And there are subvariants because of mutation, because of change of the genetic structure of that particular virus. The Omicron BA.2, which is now prevalent more and which is more 50% more transmissible. But fortunately, the disease which Omicron is causing is mostly mild, and the fatal cases are less than 1 to 5%. In Australia, presently we have BA.4 and BA.5 variant of Omicron. So there are multiple variants of Omicron which are going on across the globe. And this is how the COVID waves we have seen since March 2020. And we have the peak of wave 1 during August 2020, had a very critical and fatal wave 2, which was because of the Delta variant in our country, and which had a peak during the summer months of May and June in 2021, which claimed the most of the lives in our country. But fortunately, we are surviving. And now we just saw another wave 3 with the Omicron variant, which claimed lesser lives, but it had spread very fast and transmitted very fast to the entire globe. And presently we are going through the wave 4. The variant is Omicron A.2, but it is a mild disease, less than 1% hospitalization, and fatalities are very less. Then this is very fresh. This is today's newspaper, Times of India, which said that 37 swine flu cases was reported in Ghaziabad this month. The swine flu, so basically swine flu, or whether it is bird flu, these are influenza viruses. Influenza viruses had been there across the globe. The present concern is because the flu virus of pig, the flu virus of birds have mutated and cause infection in humans. That is why these are labeled as swine, which actually means pig. So it was the virus of pig which were infecting the pigs, and now it has mutated from pig to the humans, and there is human to human transmission as well. So the problem with influenza virus is that it has a capsule around, and there are structure, the neuroaminidase and heme agglutinin. These are two structural changes which leads to multiple mutations and multiple new forms of the influenza virus, and they are labeled as H1N1, H1N2, H2N1. So there are multiple combinations of these viruses. There are multiple mutants of these viruses, and they keep on coming every year in a wave form. Fortunately, the swine flu doesn't have mortality in the tune of Delta variant, but these are viruses which are troubling. And oseltamivir is the only drug which has been used during swine flu waves, which we have seen in 2009, 2019, and till now even the cases of swine flu are coming out. Then we have bird flu, the H5N1 variant or H7N9 variant, and these viruses spread from duck, swan, chicken, and turkey. And because of the waves of bird flu, because of the prevailing pandemics and epidemics of bird flu, thousands and lakhs of birds were killed and not transported and not utilized for their meal. So this is avian influenza, the bird flu. So now we see that there is swine flu, there is bird flu, there is corona, there is monkeypox, there is hand, foot, mouth disease, there is tomato fever. All these viral diseases are prevailing across the globe, and they are the concern because we don't have a specific treatment for them, and the immunity and our body defense is the best part and best defense against all these viruses. Because of mutation, because of their genetic changes which occur very frequently, we cannot make a lot of antiviral drugs, and even antiviral drugs will fail as the virus mutates. That we are seeing in the corona as well. That despite of vaccination twice, despite of booster of the vaccination, the people are falling sick with corona variants, newer and newer variants and newer and newer mutants which are coming up in the world. So what is the final answer against the viruses? I cannot describe multiple viral diseases. There are viral diseases which can actually cause hemorrhages. The patient dies in the pool of their blood, their own blood. So there are viruses of such variety. So, and we don't have antivirals for these drugs, for these diseases. So the final answer is that you keep your immunity and the health in the best of the state. Thank you.
That was quite elaborate, Dr. Sharad, and I think many of our questions got answered.